Okay, this is exciting. I have said that I'm going to be launching a women's health community for what seems like forever, and I'm finally fucking doing it. So I wanted to do like a little intro video in terms of like why I'm launching a women's health community, what it's going to look like, and why on earth have I called it Have You Tried Peppermint Tea? Okay, so let's start with the why. Why do I want to launch a women's health community? The simple answer is that I just feel like we need one. We do need to talk about women's health more, and it is just not getting the recognition that it deserves, mainly due to so much stigma that still exists around women's health. So, we as a society in general are just not comfortable using the words vulva or vagina or ovaries, cervix, uterus. We're just not. We're not there. And we need to get there because they are parts of our body that need attention and respect in the same way that, other healthcare deserves attention, respect, funding. Speaking of funding, it is massively underfunded, women's health. So that is a big reason why we need to talk about women's health more. So the way that I see this community working is kind of a mix of podcast, hopefully some kind of like community chat. I want to get some guests involved. There's lots of people in their own kind of fields of menopause, period experts, different charities. I'd love to speak to celebrities that have got a platform that, have these chronic conditions themselves, maybe somebody with endometriosis, somebody with PCOS, somebody who has experienced miscarriage and is happy to talk about it. So yeah, there's really like a whole range of people that I want to speak to. And a big reason that I'm starting this community is because when I was diagnosed with endometriosis in 2018, I quickly realized that I didn't have any kind of like support network. That was a really big hole in my life because I felt really, really alone. I felt like I was the only person going through what I was going through. And as it turned out, it wasn't just me, it was millions of other women. And having that support network has been incredible. The problem is that these stories from women are staying in these siloed groups. So you've got the Facebook groups, you've got the WhatsApp groups, you've got the in-person meetups. These are all amazing for women individually, but these stories are not getting out into the open. They are not being heard. And if they are being heard, they're not being listened to. They're not being actioned upon. Nothing seems to be happening at the rate that we need it to happen. There is not the funding in place that we need for women's healthcare. The waiting list times in the UK on the NHS are appalling. Private healthcare is really expensive and unaffordable to a lot of people. And really, we shouldn't have to go down that route anyway. So there's so many reasons why I'm starting this group. I just really want it to be a place where women can come together, they can be inspired, they can be empowered, they can hear from other people, they can get guidance, there can be resources. I want it to be as big as it can be. I'd love to, reach as many people as possible and help as many people as possible. There is just, there's so much power in unity and in community, and I am just one voice. I am not a surgeon. I am not a research scientist or a medical professional. I am none of those things. And those people are incredible and they're doing amazing things. But I can't do any of that. So I was like, what can I do? What can I bring to the table? And the answer is that I have marketing skills, I am outspoken, I am opinionated, and to be quite frankly honest, I am a bit pissed off. I'm pissed off with the current situation that women's health is in, and I want to try and do something about it. I really want to try and instigate some kind of positive change. That is a big ambition. I am just one person. I have not done this before. So who knows? Who knows where this journey will take us? But I am 100% committed to building this community, and I would absolutely love for you to be involved. So if you are interested, I'll link any kind of relevant bits and bobs. Yeah, I'm just so excited to launch this community, and I'd really love it if you got involved. And please do share it if there's anybody that you know in your network that you think might benefit from a community like this. It is not just a community to talk about endometriosis, it is to talk about a whole wide array of women's health issues, from PCOS to periods to PMDD pregnancy, miscarriage, menopause, perimenopause, and probably others that I have not mentioned, but just everybody is welcome. You know, this is not just an exclusive space for women either. I want men and non-binary people to be part of the conversation because women's health is not a single sex issue. For instance, I have a male partner, James, if you're watching this, hello. And he has had to experience, you know, this with me. He has had to go through from a very early point in our relationship. He's had to be there and watch me go through surgery, you know, misdiagnoses, all sorts. You know, he's had to be there through the whole thing. So this is not just an issue that affects women. This is an issue that affects everybody. I want to make that very clear. You know, people, everybody are welcome to join this conversation. So yeah, I'm going to leave it there for now. As you can tell, I am super excited, talking probably way too quickly and probably not looking at the right point of the camera. But it's fine. I am new to this and I will get better. You just got to start somewhere, and I'm a big believer in just not striving for perfection, at least in the beginning, you know, just doing the thing, facing the fear, doing it anyway. And that's what I'm doing. So yeah, don't know where to look now. Am I here? Am I there? I don't know. So yeah, I'm going to leave it there for now, and yeah, speak to you all soon.